Tulsa Spine and Rehab has chiropractic care available, as well as physical therapy, massage therapy, and other forms of treatment. So how do they decide what's right for you? Here to discuss that is Dr. John DiMaggio. Dr. DiMaggio, how do you develop treatment plans for each patient?
So when the patient comes to the office the first day, usually that's a little bit longer visit. We're doing an exam, taking a thorough history, getting a medical history, surgeries, accidents, medications, all these things to help factor in, and then kind of finding out what they've had in the past, what's worked, what hasn't, and based on your exam, their history, their presenting complaint and the way that it's affecting them, you start to develop kind of what kind of goals does the patient have? Do I just have some tightness? Do I need to resolve? Or do I have, a severe problem? I can't even get up, in the morning, or I can't sit down, or I'm in pain all the time. So taking into a lot of different factors, and then kind of balancing that with your experience and how you've seen this case or that case resolve, or what is going to work better for a patient. It's kind of a grab a little bit from each basket and then start to meld it together. So we try to make the treatment plans as individual as possible. And along with that, we don't do a typical chiropractic treatment plan where it's like 3 or 5 weeks worth of treatment, off the bat. We kind of do maybe a week or 2 or 3 or 4 visits at a time to see how you're responding, and that will allow us to kind of go back and forth if we need to tweak something, or if you're not responding, we can kind of add something in or take something out. But we like to kind of take the patient on a patient-by-patient basis.
So the patient needs to plan on spending some time that first visit for the comprehensive analysis and really trying to figure out what's going on.
Yeah, the first visit is usually a little bit longer. We try to keep it, relatively reasonable. We don't want to, keep patients here all day, but at the same time, it's sort of different here as well. We'll like to treat the patient on the first day if we don't think they need some kind of additional imaging or testing before we do that. But, if they're ready to go and we think their presentation is, it's okay to treat them that first day, we're going to do that. So we want to get them get them starting to feel better that first day. Cause, one of the biggest complaints I hear is I have to go the first day to get examined, then I have to wait or come back a second day to go over results and then get treated. And so it's, when you're in pain, the last thing you want to do is put that off another day or two. So we try to either get, a little bit of just, some modalities here we can do to get the pain level down or get them moving a little bit better so that they're, they've at least got something to take home with them that they're like, okay, well, this is at least starting to get a little bit better.
So you and Dr. Riley both specialize in chiropractic care. Do you run into cases where you have patients, you say, you know what, maybe chiropractic care isn't the best for you. Maybe we ought to send you over to physical therapy, that sort of thing. I mean, given the nature of Tulsa Spine and Rehab, you have that flexibility, don't you?
Yeah, and that's one of the great things about the clinic is, a lot of times people have shoulder problems with back pain or neck pain. Same thing, hips and knees tend to go with low back. And so they may have something that they think is low back or hip, and it turns out to be that it's, an extremity problem. So that's the great thing. We could say, hey, Ryan, Megan, Holly, one of you guys, can you take a look at this, see what you think? And if they think, we kind of agree that it's, something that may be better suited for physical therapy, we're probably going to refer them to them. Or, Dr. Riley's got a great network of, referrals within the Tulsa area in case it's something more severe, neurosurgery, whatever the case is, orthopedics. They've got a good handful of people that they can, send you out to if they think they need a second opinion.
So a patient comes in for that initial examination and then you formulate a treatment plan. How can those treatment plans evolve over time, and how do you sort of monitor that to make sure that the treatment is evolving with the progression of the ailment?
So we usually have we'll set kind of a threshold. So every so many visits, we're doing a re-exam. We're having patients fill out outcome assessments. So it's usually they're pretty basic questions like, how is my pain affecting my daily living? So I can't do laundry, I can't pick up my kid, whatever the case is. So we've got these check marks. So every couple of visits, we're going to have, check in with the patient, sit down, see how they're doing. a little bit more thoroughly than, the everyday visit. And then having them fill out these assessments. So, how is your range of motion improving? We're going to be testing that stuff. How is your functionality improving? Are you having it, finding it easier to get up and down stairs? And that was the problem before, or carrying things is easier now, or whatever the case may be. So we've got some things put in place to kind of monitor their progress. But more often than not, you're just going to, be communicating with the patient. I was sore after this day. This helped me more. I think that this is helping, or whatever the case is. We try to stay in constant communication to see what's helping, what's not, and what maybe we can change.
Tulsa Spine and Rehab has a range of treatment options available to address your aches and pains. Give them a call to see how they can help you. 918-743-3737.